Good morning, Martha. Thank you for taking the time out of your day to be here to tell us about our featured career, which is surgical technologist. To start us off, can you just tell us a little bit about your job and what a typical day might look like in your role?
Well, we start very early, so I'm usually in the operating room or in the area around 6:30 in the morning every single day. Getting things prepared, looking over my count or my preference cards to make sure that I have all of the instrumentation that I need. From then on, it is a rush all day long. I'm fighting the clock the entire day while I'm thinking about everything, kind of a step ahead of everybody. I want to make sure that I have things, and if I don't, I give the central sterile department enough time to get the things that I need.
Sure.
Yeah.
And so I know in healthcare, sometimes they have, kind of longer shifts. It's not your typical kind of 8 hours a day, 5 days a week job. Is that the case for you, or do you work more kind of a traditional 8-hour day?
Well, since I work in a surgery center, my hours are more regimented, but surgery is always, you expect the unexpected things pop up and
Sure.
Things go over frequently. So I try not to make appointments after work because, typically my day goes over without notice.
Sure.
You have to stay until surgery is done.
Tell me kind of just some of your favorite things about this role. What about the role do you enjoy? And then maybe conversely, what are some things that you don't prefer, things that, are kind of sticking points in the role for you?
I love the camaraderie in the operating room. We work very hard and we count on each other a lot. So you get a real family type bond with, your circulating nurse and even your surgeons. So just to stand next to a surgeon for hours is really intriguing. I learn something every single day. It's very fun. Some of the things I didn't expect were having to wear PPE every day. I'm required to wear a gown and goggles and a face mask. And it can get hot in the operating room sometimes, and you can't touch your face, to scratch an itch, or if you have to cough or sneeze or anything, you can't touch your face or walk away from the sterile field. So you have to kind of stand sometimes for hours at a time. If you have to go to the bathroom, you can't just go to the bathroom. You have to call someone to come and relieve you,
Sure.
Wait for them to put on a gown and gloves and scrub in order to let you out, go to the bathroom. But I never really expected that. I can't have pretty fingernails or no nail polish or, the eyelash extensions are prohibited. They could fall into a patient. So we don't get to have any of those fun, girly things that we all like.
Talk to me a little bit about the career path to get into this job. What kind of experience and training is needed to do this role?
Well, actually, I worked at Steelcase for a long time, for about 20 years, and my position got eliminated. So I went through Michigan Works, as a matter of fact, through No Worker Left Behind program a couple years ago. Yeah, so that's kind of a fun little fact. But I had heard about it. I never knew this position existed, and I heard about it in, researching the new career, and I always liked icky, bloody things and,
Sure.
Murder mysteries and stuff like that, so the whole thing kind of intrigued me. So I went to Baker College, and we took asepsis classes and sterile processing classes, instrumentation, a lot about surgical instruments, and a lot about sterile technique, microbiology, anatomy. It's a 2-year program at Baker College.
Okay.
And about half of the year, second year, is clinical rotations where you're actually in the operating room and working. Yeah, it's pretty fun.
Right, yeah. I'm glad West Michigan Works was able to help you out. That's what I hear.
Great.
For your clinical rotations, do they place you, or is that kind of up to you to find a spot to go, or how does that work?
They do place you. They have agreements with hospitals around the state who let you come in and, work. You get college credit for your clinical rotation, and you're required to do, at the time, I think it was 200 hours, maybe. I think I worked about 6 weeks, 40 hours a week.
Sure.
A little over 200 hours. And then you're set up with a preceptor in the hospital that you work with continually. And then that person trains you and guides you and, helps you learn.
Got it. Yeah, that's pretty cool. That's some good hands-on experience.
Yep. We did two different locations.
Okay.
So I worked at Helen DeVos, and I worked at Metro, which is now University of Michigan Health.
Yes.
And the goal of your clinical rotation is to get a job. So when you do your rotation, you really want to think of it as a long-term interview.
Sure.
If they don't like you, or if you don't like your performance, then they're not going to hire you. So that's pretty important to make a good impression.
Yeah, absolutely. What kind of personal qualities or abilities would you say are important to being successful in this kind of work?
Oh, well, I think one of the important things is to not be too sensitive. When you're working in the operating room, things are going very fast.
Sure. And
we tend to talk, I don't want to say harshly, but we are to the point. And I think if you are, very tender-hearted, then you can get your feelings hurt a lot. And it's really, it's not anything personal. It's just we are on a time crunch always, and it's kind of, shouting orders at each other. But, you have lunch with these same people, and everything is fine.
Yeah, sure.
Yep. The pace is fast. You have to have good hand-eye coordination. You don't want to be dropping things for sure. And kind of being able to anticipate what's going to come next. You always want to be a step ahead of the surgeon. I always try to guess what they're going to want next. So I have that suture in my hand, and I know if they're going to suture, then my next step is going to be to cut the suture, so then I have my suture scissors ready. So your steps are kind of always in progress, and you have to be able to remember the steps and actually different procedures. If they're general surgeries or eye surgeries, all of those tools and all of those different doctors who use different sutures or different instrumentation. So good memory is key.
Yeah, absolutely. So I know you said you worked your steel case for quite a long time before kind of getting in this career a little bit later on. So, thinking back to high school, how does this role compare to what you were thinking about doing as a career then? Did you ever see yourself in the healthcare field in high school, or did that kind of all come later in life?
No, I never did. I always wanted to be a flight attendant.
Really? Okay.
That was my goal in life. Yep. This kind of came about. Well, my dad worked at a steel case, so he got me into steel case, and when I worked there, I was in logistics, and I loved it, so I thought I would retire from steel case, and that was kind of a second career for me at age 40. Sure. I left steel case when I was 40 years old, so I went back to college a lot older than all of the other kids who were in my class. Yeah,
I believe that.
Yeah.
How about opportunities for growth or career advancement for this role? Is there kind of an opportunity to work your way up a little bit once you get into the role, and talk to me a little bit about that?
Well, you can go to be a first assist, which means that you can actually suture the skin yourself. If you're a surg tech, you cannot alter tissue. That's one of kind of the scope of practice. You have to stay within your scope. So you can't alter tissue. If you are a first assist, then you can learn to suture and even cut tissue, which is kind of fun. That's about another 500 hours of clinicals to be first assist.
Okay, yep.
And then you could move into an educator role.
Great.
So really, the only step from surg tech is to become a first assist and then educator.
Yeah, that makes a lot of sense. What kind of general advice would you have for students or for individuals who are interested in considering a career in surgical technology?
I think you have to be prepared to always be in a hurry. My kids were smaller when I took on this role, and I could never make a phone call. I counted on my husband a lot to take care of the kids. The kids knew not to call because you just can't get to a phone. So they would call their dad if there was an issue.
Sure.
Yeah, just hurry, and your mind is racing for 8 hours every day.
Yeah, like you said, you're always kind of on the clock. So yeah, I can see that's important.
Yep. But fun.
Yeah.
A lot of fun.
I believe it.
You see great things that, nobody knows what goes on in the operating room, but you're in a very small elite group.
Sure. It's kind of its own little world. Yeah.
Yeah. Pretty cool.
Yeah. Before we wrap up, Martha, any kind of final thoughts that you'd like to share before we go? Anything that you feel is important to mention that we didn't cover about the role?
Oh, let's see. There's a huge learning curve. I expected to, other jobs, you get on the job and you kind of learn quickly and you're set on your own quite quickly. I was nervous every day for 2 years. I would bring my schedule home at night and I would research what I needed, the steps in the surgery that was coming up. So, yeah, I would say for at least 2 years, you're going to be nervous and, not quite sure of what you're doing as you learn. I wasn't really prepared for that. I thought I would just be, learn it and off I would go. I was surprised at how long it really takes to learn all of the instrumentation and all of the different equipment.
Yeah, that sounds like a lot of dedication for sure. Well, great. Martha, thank you so much for being with us again and taking the time to share your story and this great information about the surgical technologist occupation. We're going to hear from a couple other folks on their occupations now, and then we'll have some time for questions from the students at the end. So thank you again so much for being here, and we appreciate you taking the time out of your day. Good morning, Carrie. I want to start by thanking you for taking the time out of your day to be here and tell us a little bit about your career. To get us started, can you begin by telling us, just a little bit about your job and what a typical day might look like in your role?
Yeah, absolutely. Thank you, Trevor, for having me. And I would love to talk about respiratory therapy. So respiratory therapy, a typical day for respiratory therapy can be just about anything. When we walk in, we cover everything from ER to family birth center to med surg to ICU to OR. We help if they have patients crashing in OR or something, we would get called into there as well. So we can do anything from manage airways to nebulizer treatments to managing the ventilators, also known as the life support machines, to seeing outpatients. So we can see a lot of different things on an average day.
Yeah, absolutely. So, respiratory therapists, do they typically work kind of strictly in a hospital setting, or do you do other kind of outpatient clinics where you might run into a respiratory therapist as well?
Yeah, so for respiratory therapy, that's a really great thing about our career is that we can do a lot of different things. We have the inpatient side of it where you're working in the hospital, and that can look very different at each different place. So here at Zealand Hospital, where I work, we kind of work in multiple different departments on an average day,
Sure.
where like Butterworth or Blodgett, you're more, kind of specialized, where if you work ICU, you're working ICU that day, or if you work ED, that's what you're working. But then we also have outpatient settings where we can work, where we can do pulmonary function testing. COPD education is a new and upcoming thing that is going to be really important coming up here.
Sure.
Then we also have respiratory therapists that work in home care and can do more educating on the home care side, as well as making sure patients are using their oxygen correctly at home or their other respiratory equipment at home as well. And then we also have respiratory therapists who work in sleep labs. So doing sleep labs for obstructive sleep apnea and helping with those testings as well.
Got it. What does the career path to get into this job look like? So what kind of experience and training do you need to be a respiratory therapist?
Yeah. So to start out in respiratory therapy, it is an associate degree career. So there's several, I think 4 colleges in the state of Michigan: Kalamazoo Valley College, Montcalm Community College, Muskegon Community College, and I think Delta Community College is the other one that has a respiratory therapy degree, and it is an associate degree. And that would be your entry level. If you want to go into management, which I'm in, then you're looking at more of having more advanced degree of a bachelor's of some sort.
Sure. Tell us a few of your favorite things about this role, and then conversely, maybe talk about 1 or 2 things that you kind of don't prefer, you like the least about it.
Yeah. So, I love the role that I'm in. As a respiratory therapist, I get to, educate my patients. I get to see them from the very beginning of their stay in ER. And a lot of times we get to follow them all the way till they're discharged and help with that discharge planning part of it. To see a patient come in who cannot breathe, who is struggling to say one word, who might look a little blue and you have to get oxygen on them, or even, further into a BiPAP, or if we have to help intubate and put them on life support, and then to help them get better for the next couple days or a week or so, and then to help them and see them be able to graduate and go home and be successful at home, and to build that relationship with them is just so rewarding. And to be able to see that and to see that in the patients, it's great. I love it. I love every bit of that. I think for me, the parts of my job that I do when I see patients, it's not a task for me. I don't see that as a task that I just check off throughout the day. For me, it's building that relationship with the patients.
I love that.
The things I don't like about it, I think sometimes just being pulled from one place to another quickly to put out fires with emergencies. That
Sure.
And we've had a lot of that in the last couple of years with the pandemic. So that was really hard.
Yeah, I believe that wholeheartedly. Yeah. What kind of personal qualities or abilities would you say are important to being successful in a role like this?
Yeah, for respiratory, I think you need to have kind of a serving mentality where, like, we're here to serve these patients. We're here to help them, get better, feel better. That's really helpful. To be able to communicate and to be able to just get down with the patient on their level and really get that connection with them is really important. So to be able to talk with the patient and to be able to communicate with them clearly and to be able to connect with them, those are things that we really look for in people we hire.
Great. I know you mentioned that you're in a management role currently. Can you tell me a little bit about kind of some opportunities for growth and career advancement for individuals that are in a respiratory therapy role?
Yeah. So it really depends on where you work, but in the health system that I work for, there is a lot of opportunities. So for my direct role for what I went through, I was a floor therapist, and then I went in and I learned how to do all the outpatient testing. So I learned new, more skills and really refined those. From there, I went and I was hired as a lead respiratory therapist, which really, a lead respiratory therapist, what I did was I helped out my coworkers with staffing and making sure protocols and policies were up to date. After that, then I did apply for the supervisor role. And that's what I currently hold here at Spectrum Health Zealand. Now, great. Downtown at Butterworth, there's even more opportunities. They have several lead therapist roles. They have an educator role. They have a quality lead therapist that does quality. And then they have they have a couple that do just education. So you can go through those lead roles and use those. So if your skills do that better, that's great. They also have charge therapists down there where you're in charge for that shift. You're in charge of this group of people. Sure. And so the hierarchy of that would be floor therapist, charge therapist, lead, supervisor, manager.
Yeah, that's great. Sounds like there's all sorts of options within the field to kind of cater to your skills and your interests.
Absolutely.
So, Carrie, the healthcare industry, it's pretty heavily represented on, TV and in the movies and in the media. So what would you say are some kind of myths about your profession, or what isn't like what you see on TV and in movies day in and day out?
Yeah. So my favorite is, we're just the breathing people. We're here just to help people breathe, and that's all we do. We give nebulizer treatments, and that's it. Sure. And that's what you hear on TV, and that's so not true. There's so much more than that, than what we do. And I feel like as respiratory therapists, we're a highly skilled group of people who we do a lot. And to see them when they're like, I think I saw like on an ER show one time that they had like a nebulizer in someone's mouth saying, "Oh, we're putting them on life support." And I was like, it's not even the right equipment,
Right.
So, stuff like that, that's hard to see. And sure. Respiratory therapists are more than just a task person. We do more than just check off our tasks. We do a lot of educating and trying to help patients see why quitting smoking is good for you, why, doing these breathing exercises really do help you and can help more than just your lungs, but help you all around.
Yeah, absolutely. That's important.
Yeah.
Think back to high school for me. How does the role or the field you're in now compare to what you were thinking of doing as a career back then?
Yeah, back in high school, I knew I always wanted to go into healthcare. My family, they're all in the education field. They're all teachers. And I knew I didn't want to do that. That was not for me.
Sure.
But I had one or two aunts that were nurses. And I was like, that's what I want to do, healthcare. I want to help people. I've always had a serving type of mentality. And so I knew I wanted to serve people somehow. At the time in high school, I went through a class called Allied Health, and it kind of let me explore several different healthcare professions. I knew I wanted something hands-on, something I could educate people in. But also I wanted to, everybody at that age wants to be involved in trauma and sure. That type of stuff. And so I was looking for careers like that. I looked into nursing. At the time, nursing had a huge wait to get into nursing school. And that did not line up with my plans with my then boyfriend, now husband. We wanted to, I wanted to get into school. And so I started really digging into what other careers there were. And when I found respiratory and found all the really cool things that we get to do, I was like, yep, that's it. That's what I want to do.
That's fantastic. So when you first actually started the role, was it a lot like you had thought going through school, or were there any surprises that you had when you first kind of, boots on the ground started in the field?
Yeah. So I remember, and my staff knows this about me, and so do the nurses that I work with. I have a really weak stomach. And so when we talk about body fluids, vomit, anything like that, I gag easy. Sure. So I remember my first semester of respiratory school, and we had to go in and suction patients and suction the mucus out of their lungs. And I remember dry heaving every day. And I remember my clinical instructor saying, "Carrie, I'm not sure this is for you. Like, you have to get over this."
Right.
And I was like, I will. And I did. I got over it. I can fully suction a patient, not have any issues. Not, But the nursing staff, everyone else do know there are certain things I cannot do. And that's why I'm a respiratory therapist. So I don't have to deal with vomit or, bowel movements or urine or anything like that. That is not my gig. I will help. I'm a person who loves to work as a team, and especially a patient care team to help my patients. However, if our patients are vomiting, they also know I'm one of the first ones out of the room.
Sure. Yeah, that's an interesting spin on it. I think with the healthcare professions, you think that, that's in every single role. So it's a good perspective, I think, to hear that you can maybe avoid some of those parts of it if you want in the respiratory therapy field.
Right. Well, and the nurses, they always say, we don't do sputum, Carrie. We don't do sputum. We don't do snot. I'm like, sure. I will do that, but I'll do that. You do your stuff and we're good. That's the only line I'll draw. I'll help you with anything else.
Perfect. What's some good advice that you might give to people who are considering a career in the respiratory therapy field?
I would say for respiratory therapy, there's so many different options out there. Please come talk to one of us. Come shadow us. We love to have students come shadow and see what we do. I cannot say that enough, because you can see the stuff that we do. So, get a hold of us, get a hold of any of the hospital systems and ask if you can shadow a respiratory therapist. Education is expensive, and the last thing you want to do is get part of your education done to find out that's not what you want to do. So please come ask questions, shadow, see what we do, see if it is something that you really would like to do.
Fantastic. Yeah, I think that's great advice to really, get that hands-on experience and kind of seeing someone in the role to really try to get a good understanding of what it might be like.
Absolutely. And, if you're looking for a role in the healthcare field where you're going to be secure in a job, respiratory therapy is where to go. We've really kind of we shine in the forefront currently right now, just with the pandemic, with COVID-19 and everything that we've had to do through that. But we have all these sick patients that are coming also that are going to need us for other severe things too in the next, several years. And if you're in respiratory, you're always going to have a job. There's going to be a job. Currently right now, we can't graduate people fast enough. We have many openings because we just need more people. And so, if you want job security, respiratory therapy is where to go. We can hire you.
Great. Any final closing thoughts, Carrie, you'd like to share kind of before we wrap up?
Yeah, something I always like to say is I love the field of respiratory. I love that there's so many things that I can do, and that my everyday day never looks the same. You never know what's going to roll in that door in ER. You don't know if, a trauma is going to roll in, or, a heart attack, or maybe someone having an asthma attack, or maybe you need to go help manage an airway for conscious sedation because someone needs stitches. There's so many things that we can do, and you never know what that's going to look like. So that's part of the exciting part of a respiratory therapist, is that it's always changing. And I know most of us are creatures of habit. We like to keep things kind of the same all the time, but change is good too. And seeing just different things every day, it's fun. It's fun and exciting. So, please come see what we do. Help, ask us questions. We love to educate people. And we would love to have you guys, come in and go into respiratory therapy.
Great. Well, Carrie, thank you so much again for taking the time to share your story and all this great information about the respiratory therapist occupation. We're going to do one more interview after you, and then we'll have some time for some questions from the students. Good morning, Katie. I want to start by thanking you for taking some time out of your day to talk to us about the CNA role, the Certified Nurse Aide role. Can you start by telling us a little bit about the job and what a typical day might look like in a role?
Yeah, absolutely. So with a CNA, you are doing hands-on care. You're providing care to the elderly residents or clients within the nursing home, or we do have some positions that are out in the community as well for people who prefer to be at home and take take on that role of being inside of their home and helping them. So with doing the hands-on care, you're assisting with anything that they would potentially need help with, getting dressed, undressed, maybe getting out of a chair into a wheelchair, vice versa, using the restroom, taking a shower, if they need help getting their food set up or plated or assistance eating. All of that is stuff that would be the role of a CNA. So with being a CNA, you do get a lot of information about the residents or the clients with how they transfer, how they eat, what their diet is, if they wear briefs or if they have special socks like Ted hose, things like that, different creams. So you do get a lot of information. So you are a very vital person taking care of them, as well as nurses and things like that as well. But the CNAs do the majority of the hands-on care and caring for our residents. So depending on the shift that you would take, you're going to be assisting with different meal times, different days throughout, or different times throughout the day. So with first shift, a normal day doing first shift is you're coming in and you're assisting getting these residents or clients up and ready for the day. So that would be mostly where the showers and baths come in, getting them dressed and put together for the day, getting them ready for breakfast, and assisting with getting them out to the meal, into the dining room or wherever it may be that they're going to be eating. And then after breakfast, getting them to maybe an activity or down to meet with family, or we do a lot of different outings within our company. So they're going down to get on a bus to go out and do something for the day. And then there's also lunchtime when you're on first shift. So same thing, getting them down and prepared for their meal. Sure. After lunch, a lot of our residents or our clients like to take a nap or like to get in their chair and watch TV, relax for a little bit before, going on with the rest of their day. And that's pretty much what you're doing. So assisting them and guiding them throughout the day with anything they need. And obviously within those times, there's going to be toileting and brushing teeth and all of that. Second shift, when you come in, usually it's getting people up and out of their chair or up from their nap, getting them back out and about onto the unit or in their home, wherever they want to be at that point, and then getting them prepared for dinner. After dinner, you're getting them ready to go down for bed. So, getting them prepared for that. Again, brushing teeth, getting them cleaned up, all of that. And then third shift, a lot of the time they're sleeping. So you're just assisting with anything they may need throughout the night. So if they wake up and need to use the restroom, if they wake up and want to move around, if they need any sort of medication, things like that, you would obviously make sure the nurse is aware, and the nurse is the one who comes in and provides that. But you are their lifeline kind of to whatever it is that they need to do at that point. So being a CNA is very, very, it's a job that you have to have the heart for. And it makes you feel really good about doing it. And being in there, these residents become like family to you. Okay. So you are pretty much taking care of family, and they look at you the same way.
That's great. That was a great overview. And that was interesting to hear the differences between the shifts. Thank you. Yeah. What does the career path look like to get into this role? So what kind of experience or training do you need to be a CNA?
Yeah, absolutely. So with being a CNA, you do need to have a state license. There are ways to start off doing hands-on care without a CNA license, which we have positions that are non-certified and they're considered resident assistant roles. Sure. So you take those on, and those are in assisted living. So it's not a skilled setting. You're not doing any mechanical lifts or doing more of the harder in-depth care, but you're still starting off on that path. But in order to be a CNA, you don't necessarily need experience working, but you do need to go through the CNA class. The CNA class is provided through a number of different schools and companies. And with our company, we actually offer to help pay for fully a CNA class once someone has been with us for 6 months. So you can come in non-certified, work for 6 months, and then we would fully pay for you to go through that for you to get your certification. Classes can range anywhere from 2 to 4 weeks, up to 8 weeks, depending on if you take an excelled class or if you just take the regular class, and they will train you on everything that you need to do. You do have clinicals that you'll go to at the end where you're inside of a home, a nursing home, and you'll do hands-on care there with a resident, just like you would if you took a position. And then you do need to go through and take a state test. So I know they're moving things around right now with testing sites, but GRCC used to be a site where you will need to go in and take a state test. It's written, and there's a portion of it where you have to actually do the cares on a mannequin. So they will test you on those. And once you pass, you do go onto the website as a licensed CNA.
Great. Talk to me a little bit about some of the personal qualities or abilities that you would say are important to being successful in a job like this.
Yes. So working with residents, so elderly residency, especially with the age difference, sometimes the way people were raised or the way that they had grown up, different backgrounds. Sometimes you don't always agree with something and they may not agree with you, but being able to set that aside and be able to see past that and understand that those were different times and not take anything too personal. Sure. And to be able to still provide care 100% because our residents are everything. We need to make sure that they are taken care of and that anything and everything that they need is given to them and taken care of for them. And then, like I said earlier, having the heart to do it. It takes a special person to be able to go in and care for someone and provide all of the needs that resident or client may want. So going in there and assisting them with using the restroom and making sure they're clean. So going through all of it, the mindset, the heart, the passion to do it, being a caregiver isn't easy at all. It's a very hard role, but it's very, very rewarding. So going into that, just compassion, respect, again, having the heart to do it and the mindset to do it and knowing at the end of the day, you've helped somebody. It just puts everything into perspective and it's a really rewarding position.
Okay. What opportunities for growth or career advancement exist for individuals in this role? Where are some kind of the places where you see people moving up after getting into a CNA role?
Yeah, absolutely. So there's a number of different things you can do. So just to kind of start with, I do our corporate orientation. So a lot of times I'll use myself as an example within our company as growth. So I actually started off as a CNA. I got my CNA license in 2007, and I came into Holland Home as an aide. I did leave for 2 years when I had my kids, and I had come back. So upon coming back, they took me right back in. It's a great place to be in. Like I said, a very rewarding position. So I was in there. I actually moved around into a number of different roles because they have unit secretary positions where they want you to have that experience, that background, so you can jump in and help out, especially in dining room situations and activities and things like that. So I did that for a while. Then I started working very closely with our doctors, assisting residents on our what we call doctor day. So I was taking them in to meet with the doctors, just like they were going to appointments. But I was helping take notes. I was transcribing orders. I was putting stuff into their charts. I was doing all of that. Then I did administrative assistant work. I actually moved into a scheduling coordinator role where I was the person who was getting all of our scheduling information together for a number of our units and facilities. And I did that for about 7 or 8 years with Holland Home. And now I have moved into a recruiting role. So there's lots of opportunity to move up, and not just in that route. If you want to stay in the hands-on care realm of it, you can move into medical assisting, you can move into nursing. And again, we offer education assistance for that. Right. I've seen people go back and get like their PA or move into like a doctor role. So there's a lot of different options in this role once you get started doing that hands-on care. If being in the medical field is something you're passionate about, you can move into the hospital setting, you can move into home care, you can do inside of the nursing homes. Tons of opportunity within the medical field.
That's fantastic. Great answer. Thank you. Thinking back to high school, how does this role, or how does the CNA role compare to what you were thinking about doing as a career then? Were you always kind of feeling healthcare, or did something happen in that direction?
Yeah, me personally, I was. I know in high school here, we have KCTC, Kent Career Technical Center. I actually went to KCTC for 2 years for health careers. So I knew upon leaving high school that was something I wanted to do. And I just continued on that route. Now, as I got older and started to try to figure things out with family and home life and having that work-life balance, the hands-on care wasn't necessarily where I was envisioning myself, just with how I wanted things to be done. So that's why I was able to move into more of an office setting, but still within the medical field. Yeah. But it absolutely, being in high school, I knew that was what I wanted to do. But a lot of people don't realize that being in school. They may think they want to do something different. And a lot of people get into CNA work just by coming and working at a nursing home or in a facility, because we also have a number of different positions as well, doing like dietary or food service. We have housekeepers, we have people doing laundry, grounds, all of that. So once people kind of see what it is, then sometimes they switch and move into a CNA or a resident aide position.
Sure. When you first started your role as a CNA, what were some surprises you had? What aspects of the role were different than you expected they might be?
It is very, I don't want to say it's very hard to a point where you couldn't do it, but I was not expecting the amount of work that went into it, just because once you get into it, you realize you want to give every resident all of the time that you can. You want to make sure they're 100% comfortable and okay, and you're doing everything for them and following through every single step. So once you're doing it, when you're in school, you realize the steps of what you're supposed to be doing, and you're kind of doing them slowly as you're being trained. And even once you're done going through clinicals, you'll have a couple of clients or residents that you're taking care of. When you get on the floor and you're alone caring for 8 of them, it's just kind of more of a back and forth, and you've got to be able to prioritize and figure your schedule out. Right. So that I wasn't expecting, but it was an easy thing to figure out and kind of come to terms with and get all of that down pat. And that became completely fine. The other thing was I never expected the relationships that I was going to build, whether it be with the people I was working with, my management, but especially the families. When it comes to the residents, like I had said, they become like family, but so do their families. I have had a number of family members come in. I've had people request for me to come and take care of their parent or their loved one. I've had people come to me if someone was passing and ask if I would come and say goodbye. So you are joined into their family, whether you're family or not, blood or not, you're taking care of their loved one and they want you there. So those relationships, that was the biggest thing that I was not expecting, but again, was very rewarding.
Yeah, that relationship piece, I think, is a really kind of neat and unique piece about kind of long-term care settings like this that you don't necessarily get in a kind of an outpatient setting or a traditional hospital role.
Right.
What advice would you give to a high school student or a young adult considering a career as a CNA?
Don't give up. It's one of the best jobs that you could probably hold, although it is, like I said, hard. Sure. There is so much opportunity for growth and change and for you to become something more. And doing this job sets you up on so many levels, even with personal relationships, moving into other jobs, different areas. It really kind of sets you as a person, kind of rounds you out per se. Sure. With your character, your personality, all of that, because you get to see and be involved in so many different things. But just don't give up. It's tough in the beginning, but it's a very rewarding job. It's not hard to get into a position like this. So, just do your best, put everything that you can into it, and you'll succeed.
Great. Any final closing thoughts you'd like to share before we wrap up, Katie?
With CNA work, coming into a position, there's going to be a lot of different areas where you can work. Like I had said, hospitals, home care, inside of nursing homes. So know what it is that you prefer to do and what you want to do. Some people prefer hospitals over nursing homes. Some people prefer vice versa, or being out in the community in people's homes. But know what it is that you want to do, or try it all. Don't come into a position and decide you don't want to continue on this route. Always try something different and move around. Just to get everything, get your feet wet, make sure you know everything that you need to know before moving into something different and moving on to a different position, because this job, like I said, is so rewarding. And it's just, honestly, I held the position for a number of years, but it was I can honestly say this was one of the best positions that I've held. And I always look back on that. And if I ever needed to move back into a role like that, I would do it without a doubt.
Great. That's great advice. Thanks so much. And Katie, thank you again for taking the time to share a little bit about your story and some great information about the CNA role.
Yes, thank you.